In the continuation of the lecture, the drug methadone. Methadone is a synthetic oral effective opioid that is approximately equal in the potency of morphine but induce less euphoria and has some longer duration. It is similar to the morphine in effect somehow, but the side effect of a morphine, that is euphoria and some of dependency, is lesser with the methadone. Methadone is rapidly absorbed by oral route. The drug is biotransformed in liver and excreted in urine, mainly as an inactive metabolite. Adverse effect of methadone can be produced physical dependency like morphine. Next drug is fentanyl. Fentanyl and fentanyl are highly potent phenylpiperidine derivative with the action similar to those morphine, but with more rapid onset of action and shorter of duration of action. These point, the rapid onset of action, it's more potent. It's one of the more potent drug, but they are less effective. Less effective means the effect of the duration of action is for less time. Fent- Comparatively morphine, their main use is anesthesia. Is main use is not used for the analgesic, but it is mainly used for anesthetic agent as an anesthetic agent. And they are also given in intrathecally. They also use as a patient control infusion system where the short duration of action is advantage, and in severe chronic pain when they are administered via patches applied to the skin. Partial agonists and mixed agonist antagonists. These drugs, like nalorphine and pentazocine combine a degree of antagonists, a degree of the agonist and antagonist activity on the different receptor. They have the agonist activity. Similarly, that they are some antagonize the some opioid receptor. Nalorphine. mm, Nalorphine is example of agonist when it tested on the guinea pig, the ileum, the guinea pig ileum, but it is also inhibit the competitively the effect of morphine on these tissue. Pentazocine and cyclazocine, on the other hand, they are antagonized at the mu receptor, but partially agonist on the other receptor. Most of the drug in these group tend to cause the dysphoria rather than euphoria, probably by the acting of the kappa receptor, other including buprenorphine and nalbuphine and pentazocine. Nalorphine. Nalorphine is closely related in structure to the morphine and has more complicated action. It's similarly structurally similar to the morphine. In low doses, it is a competitive antagonist and block most of action of morphine, while in animal isolated in tissue. When it is tested on an animal tissue, it is showed the antagonize the effect of morphine in low doses. But in higher doses, the analgesic mimic the effect of morphine. If your choice of a drug is nalorphine, you can as an analgesic you can give in high doses, because in high doses is mimic the effect of morphine, or it show the similar effect of morphine, whereas in low doses it's a antagonize the effect of morphine. These are nalorphine are, you can say, these are dose dependent effect, show the dose dependent effect, probably reflect in antagonist action on mu receptor coupled with the partial agonist action of other receptor, the latter causing dysphoria, which is make unsustainable for these analgesics. Next is pentazocine, is a mixed antagonist or agonist. It's also agonist and antagonist effect with analgesia property similarly to the morphine. However, it causes marked dysphoria with nightmares and hallucination rather than euphoria. It is rarely used. Due to its side effects like euphoria and hallucination, which is the most prominent effect with these drugs, that is avoid to given as the analgesic. It is not the first choice or not the best choice for the analgesia due to this side effect. Buprenorphine. Buprenorphine is a partial agonist on mu-receptor. It is less liable to cause dysphoria than pentazocine, but more liable to cause respiratory depression. Okay, now we have toward these all are the antagonists, or some of the we are study about the antagonists, agonists, and some of the mixed combination. Now with the antagonists, uh, these drugs these drugs produce very little effect when it is on the on block on but block the effects of the opiates. The most important example are naloxone, and naltrexone, naltrexone, and naloxone. These are two drugs which is used as antagonists of the opioid receptor, or you can say is this antidote of the morphine or antidote of morphine-like drugs, or you can say the toxicity. It is also used in the toxicity of the morphine or morphine-like drug, that is naloxone and naltrexone. Naloxone was the first pure opioid antagonist with the affinity for all three opioid receptors. The main clinical use of naloxone are treated respiratory depression caused by opioid overdose. As we know that with the opioid receptor, there is a respiratory depression. With the overdose, these respiratory depression is overcome by given with the combination of naloxone. It is usually given intravenously. It is given in the form of IV and also effect produced immediately. It is rapid metabolized by liver and lasts only 2 to 4 hours, which considered shorter than the most of morphine-like drug. Therefore, it may be given repeatedly. It nullified the effect, yeah, antagonized the effect, the morphine, but there is a side effect that there less effect about 4 hours. So it is given in the repeatedly in the periodical repeated dose to overcome the side effect or to overcome the toxicity of the morphine, which have a more duration comparatively this. So these are giving timely to overcome these effects. Naloxone has no importance on one effect in its own, but precipitate withdrawal symptom in addiction. It can cause detect opioid detection. It has no significant withdrawal side effects, but it have a withdrawal symptoms. If the patient cannot take in immediately drop up the naloxone use, it's shown he or she develop the addiction of the naloxone, and that is in the form of withdrawal effects. Naltrexone, Naltrexone, it was similar to naloxone, but with the advantage of such a longer duration of action. Half-life is about 10. As we know that the last drug is about 4 hours. It's have a 10, 10 hour. There's a beneficial point. It is maybe value in addict who have been detoxified, because it nullifies the effect of dose of opioid should be a patient resolve fail. It is used in other conditions such as alcoholism and septic shock. Is being investigated, although the role of opioid peptide in these conditions is still controversial. Specific antagonists of the all of the receptor, especially all of the receptor of opioid receptor for experimental use, but not as clinically purpose. These are summarized form of a drug, the opioid drugs, and their use and their side effect. The first opioid is morphine, widely used. It is used acute and chronic pain. It used in a chronic pain, and it achieved the analgesic, analgesia in chronic acute to chronic pain, but it have a side effect of sedation, respiratory depression, tolerance, and dependency. Method, Methadone, chronic pain, maintenance of addicts. Yeah, it's used as a uh, um, rehabilitation for the addiction, and as morphine, but like euphoric effect, accumulation may occur because of long half-life. Um, Pethidine, acute pain, it is given in acute pain. It might be accidental, severe acute pain. As a morphine, side effect as a morphine, anticholinergic effect, risk of excitement and convulsion. Pentazocine, mainly acute pain. Its side effects, irritation at the injection site, may precipitate morphine withdrawal syndrome. The fentanyl is used in acute pain and as an anesthetic. Side effects similar as morphine. Codeine, mild pain. It is used in mild pain, mainly constipation, caused mainly post constipation, no dependency liability. Okay. The most important drug is which is commonly used is tramadol, acute. It is used in mainly post-operative and chronic pain. It causes dizziness and some cases it causes convulsion. Now this is the end of your opioid receptor topic. Thank you all. Hope you can understand easily. Thank you.